Okay, we're going to go ahead and get started. I want to reintroduce everybody to Dr. Lyssy. Dr. Lyssy, I'm going to go ahead and let you kind of introduce yourself, where your practice is located, what it's called, just some general information about you.
Sounds great. Chef Deb, thank you so much for having me. As you mentioned, my name is Dr. Anthony Lyssy, and I'm located in the Preston Center area of Dallas, near the Tollway and Northwest Highway. My practice is Diamond Physicians. We've been here about 5 years, and as the medical director of Diamond Physicians, I do head up all our wellness practices and wellness aspects. What is Diamond Physicians? Well, basically what we've done is create a wellness-focused, proactive rather than reactive medical practice with a membership basis to it, so we can cut out one of the biggest barriers to getting true high-quality care, and unfortunately, that's the insurance-based medical practice. We've cut ties with our insurance to allow our clients to have better access to us. We take care of fewer patients in a better manner with that real big focus on wellness and prevention that unfortunately you just can't get like you used to be able to get in a traditional insurance-based model. And so we tie in all the aspects of functional medicine, integrative medicine, preventative medicine, and we've come up with numerous ways to really take our patients' health to the next level. We focus on all facets of health, and we look at how everything is intertwined and how all of the body systems basically speak to one another, and how the things that we put in our body tells our body how to respond. And one of my favorite lines is food is information for our body. And so obviously partnering with great people like yourself, Chef Deb, we can then get our clients the right kind of knowledge, how to eat the right way, how to shop the right way, and then that makes everything that we do better. So that's really the general 20,000 foot bird's eye view of what we do and how we do it here at Diamond.
Okay. So one of the first questions I would actually ask you is, you do have a very unique approach, because I know that people hear the word integrative, they hear the word functional, they hear the word traditional, they hear holistic. It seems like that there's a lot of verbal noise around medicine these days. And how is it, tell me a little bit about your treatment philosophies and kind of what makes you different from kind of the rest of that noise.
Absolutely. Again, as I mentioned, I'm real big on the proactive approach. I'm real big on trying to find disease before it really rears its ugly head. So looking for early markers of disease, looking for early markers of really dysfunction of any system in the body. And what I really try to do is sit down and listen to the patient. I listen to what the patient's telling me. I listen to why they're not feeling optimal, whether it's brain fog, whether it's inability to get their workouts done the right way, whether it's gaining weight, whether it's joints hurting. All those things are signs that the body's not working out or not working in the way that it was meant to be. And it gives me some insight that there may be some dysfunction somewhere along the way, whether it's nutritional, whether it's hormonal, whether it's inflammatory. My big approach is an anti-inflammatory approach to healthcare. Yes, I practice medicine. I'll write prescriptions when I can, but I tell people all the time, any prescription I write is going to have a multitude of side effects. If I can get the same benefit from something non-pharmacologic, such as food or lifestyle interventions or supplementation with an anti-inflammatory approach, guess what? There's going to be no side effects. You're going to be likely to stick with it longer. It's usually going to be cheaper than a medication, and we're going to get better long-term results from it. And so the hardest part about that is, I think, removing all the barriers that a patient may have to getting their wellness in check. And so that may be things like diagnostics. We utilize the right kind of diagnostics to look and figure out how can we have a more directed approach? How can I practice better personalized medicine? Blanket medicine can get a lot of people in a lot of trouble, because what's good for the goose is not necessarily good for the gander in healthcare, and people are different. They have different genetics. They turn genes on and off in a different manner, so their epigenetics are different too. And so what I may recommend for one person may not be ideal for the other, and I've got to listen to the patient. I've got to know where they come from. I have to know what they do to find out what barriers they have to health. And that's how I really try to sit down with my patients and take the care that I give them to the next level.
So I think what people, just to kind of summarize that, and myself as a patient and what other people have asked me, really what sets you apart is you're proactive, not reactive. So you really work on prevention before whatever's going on kind of rears its ugly head or becomes a problem. I always say it's funny that my clients don't come to me until they needed food yesterday and expect me to fix it that day.
Yeah,
And,
very true. We see that a lot when people are coming in here because there's a big problem. Yeah, in a perfect world, I'd love to catch everybody at age 25 or 30 when everything's still working out well and get them ready for the next stage of their life, but that doesn't happen. People are busy. There are barriers. I mentioned a lot of those. One of the biggest barriers I did not mention is just a lack of understanding. There are so many mixed messages out there in the general public, whether it's social media, whether it's the news, whether it's any of these avenues that are telling people the wrong message. For years, how many times did doctors tell people, eat low fat, replace fat with carbohydrates? Well, what did that do? Well, now it gave us basically a country full of pre-diabetics and diabetics and with an obesity rate that's higher than any other developed country out there. And so these messages based on the wrong kind of theory and based on a lot of people doing some pretty bad things behind the scenes to change the message that was delivered, it cost a lot of people their wellness. And so education is big. I will sit down with someone, explain the pathophysiology and the pathogenesis behind a lot of these chronic dysfunctions of the body and explain why we're in this position and how we can fix it. And so when I get a patient to truly understand why I'm making these recommendations, they're likely to follow those recommendations. And so again, it's not just saying do this, do that. It's here's why you're in the position you are, and here's why my recommendations are going to get you out of that position and get your body in a better shape to take care of itself. The body does an unbelievable job of fixing itself and regaining that homeostasis. We have to give it the right tools, and we have to put it in the right position to succeed.
Yeah, if we stop screwing up that process, sometimes if we take us out of it, it's amazing how it does that on its own.
Sure.
So really what I want people to hear, what makes you so different, and because you work in your business, all the time, it's hard for you to hear these exact things. But what you said that most people want to hear is preventative and proactive, root cause, and then you don't push meds first. You have that in your arsenal if that's something that you want. But the biggest thing I think that people are going to hear is there's an education component to what you do, that you kind of cut through the noise and the overwhelm. Because I think some of the worst things that people do is they type in whatever's going on Google. Next thing, people come into you with everything from MS to cancer, and they're convinced, type of thing, without ever actually seeing you. So,
yes. We see the Dr. Google consults all the time, unfortunately.
Well, all four of those things you mentioned, the preventative, root cause, the medication second, not first, and you kind of cut through the overwhelm, that's truly what sets you apart, and that is a complete 180 of the healthcare system that we see nowadays. Tell me a little bit, there's always a why in the reason why, and no offense, you're no longer in the traditional medical world. You kind of chose to do medicine differently. What happened? Why?
So in the medical training process, it's a long road. I mean, you go through 4 years of medical school, 4 years of undergrad, then 4 years of medical school. You go and follow doctors that, are doing what you think that you would like to do. And then you go through residency, and you're forced into a pretty small window of a scope of practice once you do specialize. And what I really got to is I got to a point saying, okay, here I am in my medical training, and I see these patients actually listening to their doctor and taking all the medicines that are prescribed, but why are they still being admitted to the hospital every 17 days to show up on my service at 3 a.m. and I have to admit them? I see a failure with traditional medicine. You look at the disease rate, you look at the obesity rate, you look at the rate of insulin resistance, and you say, okay, something's not working, whether it's poor education from a physician's standpoint, whether it's medications that aren't working, or more importantly, are actually causing more side effects than they're really improving. You look at all of these things, and we're spinning our wheels in healthcare right now. We're sicker really than we've ever been. This is the first generation that's actually more unhealthy than the predecessors, which is an alarming trend. And I looked at, I said, what am I getting myself into? I don't feel that I can come out and do all of these things that I was trained to do and just throw prescriptions at people and treat numbers, but have the same outcomes or worse outcomes. So I started looking at what other options were out there. And at the end of the day, when you really start looking at what sticks, it's education, it's patient relationships, it's trust, and it is taking the time to get someone from point A to point B, but taking as many steps as you need to get there and doing it in a relationship that is two-way, not a one-way street. And those are the biggest things I've found that really turned me off to the traditional model of moving patients through the office and, seeing 40 patients a day and doing the same thing for everybody and writing prescriptions for everybody and then seeing them back 2 weeks later to collect another copay if it didn't work. I didn't want any part of that. And so that's why I certainly went out and branched out, created a practice that would allow me to do the things I'm passionate about. I've mentioned many of those here today. And it's been very rewarding for myself and my patients. And at the end of the day, we're trying to teach other docs how to do this too. And so we're growing our model rapidly, and other docs are joining our practice. We're partnering with as many ancillary services as we can, from nutrition to chef services to personal trainers to recovery modalities. All of these things that are out there are great alternatives to the traditional ways of writing medicines for people, and guess what? They work better. And so that's what drew me to this model, and I'm very, very pleased that I'm here. It's very rewarding, and my patients certainly get the benefit of that.
So people from all over the country are going to be listening to this recording. Is Diamond Physicians only in Dallas?
As of right now, we are only in Dallas. However, October of this year in 2017, we'll have our first out-of-state location open in Atlanta, which we're very, very excited about. We also have plans on branching out to the Los Angeles area, and we've had a lot of interest in New York and Florida. So don't be surprised to see us growing nationwide here in the next few years. It's been one of our goals for a long time to teach other doctors how to practice in this manner, from the business perspective as well as from the wellness perspective as well. And that's my job as the medical director, to ensure that we're aligned from top to bottom, and all of our practices do preach the same things and take the same wellness approach to our patient care. It's what really separates us. There's many concierge medicine practices out there. There's many membership-based medicine practices out there. But we set this practice up to make sure our wellness came first. And that's really the fundamental that we stand on, and that's what separates us.
So they can, I know you have clients from all over the country that do fly in to see you, so that's definitely a possibility for them. You mentioned the word concierge medicine, and I talked to a few physicians that say that that's not the word that they prefer to use, even though that's typically what the normal person would understand that's not a physician. Is that the best word to describe yourself, or is there something else?
Yeah, there are a lot of words out there. I think that people most have heard the concierge medicine term. The term that really people are looking at closer now is a more depictive manner of what we do. It's direct primary care, because you're getting direct access to your doctor 24/7, and it is primary care. Other people will term it membership medicine. The concierge and the boutique medicine typically have a little bit more of a negative connotation, because they think it's only for the super elite. That's not what our practice is about. That's not what it's based on. Yes, you can get your doctor 24/7 when there's questions. And yes, it's certainly a nicer experience than going anywhere else. But whatever you want to call it, it is a direct relationship. It's a two-way street. It's a wellness practice. And so, some people will term functional integrative medicine. Yeah, I can do that. That's what I do. That's the basis behind it. But I do want people to understand that it is the membership model of our practice that does allow us to have the great personal relationships, taking care of 1/10 of a traditional volume of a practice, to allow us to get those best relationships and best outcomes.
And while I understand the term functional and integrative medicine, give me a kind of my viewer, or more of a layman's definition of that.
Absolutely. So either one of those terms, they will describe this type of physician very, very well. Essentially what happens is, rather than a physician being a dermatologist or a kidney specialist or a internist or an OBGYN or family practice, a functional and integrative medicine physician will look at the patient as a whole and look at how all the systems integrate, and look at how the body functions, and look at if there's any aspect of that integration of the body systems that is not working well. Well, clearly there's a connect. There's a miscommunication. There's either a reason behind it. There's always a root cause behind it. And so rather than matching the pills to the ill and saying, oh, well, you have cholesterol issues, so let's put you on Lipitor, heart attacks and strokes don't happen from a Lipitor deficiency. Depression and anxiety is not a Prozac deficiency. There's underlying reasons for all these things to happen. And again, it's a functional problem within our body. Something's not functioning right. There's not appropriate crosstalk between the systems. And it takes really a detective approach to know enough about all the systems and how the body integrates to then put those together, find what the toxin might be, what the deficiency might be, what imbalances are there, whether it's nutritional, emotional, physical, any of those type of things. There can be an imbalance in how the body's meant to function, and a functional medicine or integrative medicine puts all that together and tries to create really a underlying root cause fix of what the issue might be. And it's tough as that kind of physician, because what happens is just when you think you get your original goal in place, well, something else may kind of get out of check a little bit, and you got to rein it in. You have to look at all things at once and run a lot of things parallel, because everything does interact, everything does affect the other aspects of the body. And so unlike someone just treating a cholesterol number with a medicine, it's a lot harder than that. You've got to treat the arterial walls and the inflammation contained within. Well, is that from a cortisol imbalance or a parasympathetic sympathetic nervous system imbalance or a nutritional deficiency or an overabundance of a hormone like insulin that causes insulin resistance, which is inflammatory to the body and affects the artery walls? You've got to go back 3 or 4 different steps. And it's not easy. It takes time to do that. It takes a lot of appropriate workup, diagnostics, and listening to the patient and understanding what they do. And so I think that summarizes what we do in a really good way. And I hope people can see how that differs from the traditional experience with a internist or regular family practice physician.
Is that why you kind of coined the term, or you have, if you go to your website and you research, you have something called 360 care? That's
really the reason, yeah. So our Diamond 360 packages, we've basically created, so backing up, we knew that not everybody would be in Dallas that wanted our care, and maybe everybody didn't want the direct primary care membership piece of it. Maybe it wouldn't work for them as they lived out of the state or even country for that matter, but maybe they wanted the care that we delivered and the diagnostics that we offer. And so we've created standalone packages called our Diamond 360s to allow people to come in as a non-member, pay a flat fee that covers all the testing, and then get all the testing, the diagnostics, and then the management on the back end for a year. We can communicate through email. We can have video conferences. We can leverage technology to make sure we're using all of the data that we collected in these different packages and move forward with the care and the optimization. We've got a heart health package. We've got a digestive package, looking at the microbiome and the balance or imbalance that's out there, the microbiome and the biodiversity. We look at neuro health. We use quantitative EEG measurements and brainwave measurements to look at how neurofeedback can rewire the brain in a safe fashion and keep people off of some medicines that are not without side effects. We can do balance packages looking at an in-depth nutrition evaluation and pair that with functional hormone testing. We look at sleep, we look at recovery, we look at aging. And with all that, we can put it together and offer these packages to people who want to experience what we do, but maybe aren't here in town to do that.
So most of my clients, as probably a lot of your clients, because women have a tendency to kind of take the lead in healthcare and then they kind of shove their husbands through the door. A lot of them hire us because they want to take better care of themselves. And a lot of times they want to start with their food. Okay, well, that's a big component of it. But if your body's not ready to receive that nutrition, then it's not really going to matter what you eat. I'm sure that you work with a lot of the same population, the same complaints, busy moms, busy women type of thing. Tell me about some of the common things that you see in this group, just so that, because the primary audience is going to be watching is going to be, that particular group of busy moms, busy women. Tell me about some of the things that you see with that particular age group or demographic.
Absolutely. Well, we see quite a bit of exactly what you just described. I feel somewhat more trained to do that because my wife, we have 3 young children, and I see the toll that raising 3 young kids takes on her. And I see the expectations that she has of herself to put appropriate food in front of them and create a wellness environment in a very difficult situation. When I'm left at home with the kids on a Saturday while she goes shopping, I say, wow, how does she do this all week? So I get it, and I respect that. I understand the stresses that demographic experience. And so what I see a lot of, I see the, hey, I'm 38 years old, I've got 3 kids, and I just don't feel the same energy levels. I don't wake up feeling rested. I haven't in a long time since the kids were young. I feel like I'm a little bit more sluggish. I'm going to the gym. I think I'm eating right, but I'm still gaining weight. And I've got this, my clothes don't fit like they used to. And I've worked with trainers and I can't lose weight, or I have this brain fog and I can't concentrate and I feel this anxiety. And so my old doctor put me on Xanax when needed. And so I hear all of these things and I see it. And whether it's thyroid, whether it's adrenal insufficiency or cortisol imbalances, whether it's a nutritional deficiency, whether it's insulin imbalance, it's all out there. And at the end of the day, the mom just thinks, oh, well, this is what I'm supposed to feel because I'm getting older. Well, no, that's not an excuse. Getting old is not an excuse for anything, especially feeling worse. I have some of my most energized, highest vitality patients in their 50s and 60s because they're doing all the right things. Too many times I have people just make excuses for how they're feeling, and I don't want them to do that because maybe traditional medicine has failed them in the past. And so that's why somehow they find me and we uncover a litany of things that we need to improve upon. And a lot of times I will find data and explain to them, well, here's what I found, here's why I want to correct it. And they say, wow, this is exactly opposite than what any doctor's ever told me. And then 3 months later, they come back and give me a big hug and they're like, oh my gosh, I've never felt better. Thank you so much for your guidance on this. I would have never known. So I always tell people, never let age be a reason for you feeling bad. You can, outrace Father Time, and you can make sure your body is in a very good position to feel great, look great, and perform great at any age, regardless of how many kids you have or your duties. I'm big on planning. I'm big on preparation. I'm big on realistic expectations. And so it's amazing when we can put people's mind at ease and get them the right information, give them some easy to follow fundamentals for them and their family. Everything else starts coming into place. We get them in a position where their bodies can, like I said, succeed and feel optimal.
And that's exactly what I wanted people to hear, is that they're not alone, that
Yes, exactly.
What they feel is very normal, but they don't have to stay in that space if they choose not to.
Right.
And you hit the nail on the head with the brain fog, and I'm, not ever rested when I wake up. And I used to not have these weird weight gain that went weird places that I didn't even think you could gain weight in, and, all of those other things. So one last question before I let you go, because I know you have to go back and see your patients, is kind of tell me about your philosophy of using nutrition or food as medicine to assist with the overall care of your patients.
Absolutely. It's really easy to me. I've seen it in my own self. I've seen it in my family. I've seen it in my patients. Again, like I mentioned earlier, I look at food as information for our bodies. Every time we put anything in our mouth, there's a chemical reaction that occurs on the back end. And those chemical reactions will then enter or then basically, turn certain genes on and off, turn certain inflammatory reactions up or down. And, it's interesting. Everybody's different. You see one food being very appropriate for one person and then feeling great after they eat it. And then all of a sudden you find someone 2 seats down from them that have the exact opposite effect. And so by using nutrition, that's one thing, but then knowing how to interpret certain data points that give us direction, or knowing how to interpret the body's symptoms when certain foods are ingested and finding out what food sensitivities may or may not be there, and then utilizing that as really the biggest primary treatment protocol. Again, at the end of the day, people will walk out of here and they're like, well, are you sure I don't need a medicine? And I said, trust me, you don't need a medicine. We need to optimize your diet. You need education. You need a chef. You need a little bit more just commitment to the right kind of food. And it's very hard to find high quality food right now. You have to go out, and that's unfortunate for many reasons, which I won't get into now in this discussion, but it's hard to find good quality food. It's hard to find healthy, nutrient dense, organic, toxic-free food. And you got to go out and look. You got to partner with people like yourself and services like what you offer to allow people to say, okay, look, this is hard for me. Let's make it easier. Let's partner with someone who's got this figured out, and let's work with a team, physician, a chef who knows what they're doing, a functionally trained nutritionist like yourself who does the preparation. Let's make it easy for everybody. And so I'm a big believer in that because I see it on a daily basis, the improvements that come down the line. I check inflammatory markers. I look at food sensitivity. I can hear someone tell me, wow, I would have never known that that food I was eating for the past 10 years was the reason I was having these symptoms after I ate every time. I never would have understood that because I always thought that was healthy for me. And so there's so much misinformation out there. When you get the nutrition optimized, it's amazing what happens down the stream, as you know that. And so that alone reinvigorates my desire to make sure nutrition is the cornerstone to everything that we do. Yes, you can go and work out 7 days a week, and yes, you can take all the right kind of supplementation down the road. But at the end of the day, I'm still a believer that nutrition is 75, if not 80% of our overall wellness. Yes, we have to stay active, and yes, we have to get our sleep, but without proper nutrition, none of that stuff will be beneficial. So that's really my biggest focus is on the nutrition and working with people like yourself who make sure that they're doing it the right way and make my job easier because, you know, when they say, well, where do I get this stuff? I can slide your card across the table and say, let's make it easy for both of us.
Thank you for that. I love it whenever clients say, you know, because we have them fill out a detailed food questionnaire. I always call them and, you know, go through kind of a history of what's going on. And I love it when they say, I don't care, just bring it. I want it to be healthy. What's your version of healthy? Because, oh my gosh, there's some versions of healthy out there that I'm like, I don't know who taught you this, but it is not healthy.
Well, I'm going to share one anecdote with you because you'll really appreciate this. There was a certain client that I had who was working with a health professional, and I don't know if it was misinformation or if it was misinterpretation. Either way, there was clearly miscommunication because this patient who's now working with me felt, oh, hang on a second, my light went off here in my room. No, hang on, there we go, okay. Yeah, my sitting here for however many minutes turned the light off, so forgive me. I had a patient who was told that, you know, lean fish was great for them, and so he took it upon himself to be very dedicated to the plan and ate cod every day, 4 times a day for about 4 or 5 months, and then wondered why he had the brain fog, the joint aches, the weight gain of mercury toxicity, and just general nutritional deficits across the board. And I said, okay, well, there's a little bit of direction we need to. So after 2 weeks of eating the right stuff, he's called me. He said, I've never felt better. After the first 2 days of detoxing from the mercury and the pain that came with that, he's great now. He's already lost, 7 pounds in 2 weeks and feeling better. Brain fog's gone. And so, again, it's never that easy. That was one that was just slapped me across the face as, oh my gosh, we got to do this. But a lot of times you see the misinformation or just the misinterpretation of, presentations or recommendations in the past. And so you got to work with the right people. You got to have the right data. You got to have good communication. And that's really the cornerstone to anything. Communication is really the thing I feel that if you don't have it, you can tell them all the right stuff in the world and they may hear half of it. But if you don't follow up and you don't have good back and forth communication, it's never going to stick, or it's never going to be as effective as you envision it in your trained mind. So you have to really follow up and make sure everything was understood right. And that's part of it. And that's why it's not just a one-time thing. It's a chronic communication back and forth. That's really the key to wellness.
I love the partnership of the relationship that you keep alluding to, because everything you said is a continuation. You talk about a team. You talk about education, you talk about all those things. So I know that a lot of times in traditional medicine, you'll walk back in to see the doctor and they'll go, now, are you here again? Why don't I do you have a chart in front of me? You called me to come back in.
Right.
You know this. And it's just fascinating that you become part of your clients' lives as much as they wish and as much as you should be in their lives. So it's a great team effort in healthcare. That's what I really like. Yes,
absolutely. And we customize the experience for everybody with what's going to benefit the most. So I have some people who I've squared away and I've gotten them on their path and they're enjoying all the things that come from that, all the benefits. And I may speak with them once every 3 to 4 months, sometimes up to every 6 months, because they're doing great. And they don't need me as much as they did before. Maybe if they cut themselves, working at the gym or drop a weight on their toe or something like that. Okay, that's when they call me and they love that. But those are the people where, like I tell everybody, I'm aligned with my patients. And in the traditional model, there's not alignment. The doctor only gets paid when the patient is sick to come see them. My model doesn't require that. My model actually is more efficient if my patients are healthier, because they're not using a lot of my my acute urgent care services, and not texting and calling me all the time feeling like garbage. And so it actually aligns my practice and my business model with the patient's best interest, and not to mention it gives me the satisfaction of doing a job and doing it right. So that's again why I do what I do, because for the first time in a long time now our needs and our outcomes are aligned, and it works so much better.
Fascinating. Okay. I'm going to let you go back to taking care of some more of those people. What I want you to do,
Yes.
I want you to let the people that are going to listen to this know how to contact you. What's best?
Absolutely. Our website is diamondphysicians.com. You can email at info@diamondphysicians.com, and my assistant can send you some information about our services and our packages. Anytime that you'd like health advice or an occasional golf tip every now and then, you can follow me on Twitter for at Dr. Anthony Lyssy. That's Lyssy, and that's at Twitter. And you can also find that through our Facebook Diamond Physicians page as well. And so anything I can ever do to help, I'm always here. And I love working with like-minded professionals like yourself, as well as partnering up together to take mutual care of a client that needs both of our services. And so I look forward to hearing from your viewers.
And that's also physicians with an S, right?
Correct. Absolutely.
A lot of times S is on the end of names like that, because I know Sabre Culinary Services, people have really love the S. So I just wanted
There you go.
that. Okay. Go back. Go make a lot more people well. Thank you so much for being on this recording with me today, and I'll make sure it gets sent out. I'll make sure you get a copy too. Thank you so much.
Wonderful. Thank you so much for having me. It's been a pleasure. Bye-bye.